Good morning, everybody. This is Liz Choate, registered dietitian and director of clinical nutrition here at Jackson Purchase Medical Center, doing another Learning with Liz lesson with you today. So today I thought I'd talk a little bit about hypertension or high blood pressure and talk about what can we do with our diet to help with that, because actually what we eat can affect our blood pressure. So there are a few little things that we can do. So I've got just a few little helpful hints, and I have an article that will attach to this. But there are things we can do with our diet to help us out a little bit. There's a diet called the DASH diet, which stands for Dietary Approaches to Stop Hypertension, is the DASH abbreviation stands for. And it's an eating style that's high in fruits and vegetables, also things like beans and nuts, seeds, whole grains, fish, poultry, and low-fat or fat-free dairy products. And these foods are also very low in sugars, and also low with red meats and with sodium or salt, of course. So it was originally come out just to help with blood pressure, but actually this is a diet that can help anybody with any type of prevention of heart disease. So, and when I talk about salt and sodium, just remember that sodium's the great big picture, and salt or table salt is one of the little pictures that makes up that sodium. So here are the things that we can kind of try to do with that DASH diet to help improve our heart health. But get your fruits and vegetables. Think about yesterday. How many fruits and vegetables did you eat yesterday? I know my husband and I are really trying to bump up our fruits and our vegetables intake, and it's a really good thing that we're trying to do that because they have minerals and vitamins that aren't in other foods. So they're a really, really great source of potassium, which is very important for managing our blood pressure. But if somebody has kidney problems and their potassium's too high, you got to be careful too. But there's some studies that show that low intakes of potassium may be related to hypertension or to high blood pressure. So trying to make half of our plate being fruits and vegetables is kind of a goal. Nuts are an excellent source of our mono and polyunsaturated fats, which are very, very heart healthy for us to take in. Those monounsaturated fats actually help lower our LDL cholesterol level, which is kind of the bad guys. So anything that we can do naturally to help ourselves is really, really good thing. You do just want to make sure that nuts are unsalted, because if they got a lot of salt in them, then that's not really great for the blood pressure. So trying to make sure that they are unsalted. In particular, things such as peanuts, we've heard about that forever, walnuts, almonds. Now, cashews and macadamias are probably not the best type of nuts for us to have because they have a little bit more saturated fat in them, but all of the other nuts are lower with that saturated fat. Try to choose more low-fat or fat-free dairy. Regular cheese is made from whole milk, so that means it's higher in fat. So trying to go more with the lower fat products if you can. I always tell my patients 2% is better than whole, 1% is better than 2, and skim's the best. So as low fat as you can get with that milk, the better it is for you. Also, what milk contains is calcium. We know calcium is good for our bones, but did you know what calcium is very important for our blood vessels too? So getting that calcium in every day is very, very important for us to do. So those low fat or fat-free dairy products, such as your milk, yogurts, and also cheese. And then try to limit the sodium intake and then the saturated fat intake. Saturated fat is a fat that's hard at room temperature. Think about shortening, what shortening looks like. When we eat that, it makes our body produce more cholesterol, is what it does. So we need to go more with liquid oils, such as olive, peanut, and canola oil. And then on the sodium end of things, the DASH diet recommends that we get around 2,300 milligrams of sodium in a day. And it really, really can help with that, keeping that blood pressure down. Studies are shown that the diet It's low in the saturated fat plus the low sodium. It helps decrease our risk with heart disease, and it also with the lower sodium can help decrease the hypertension very, very important with that. If we don't get, say, protein from our low-fat meats, you also can get a little bit from things such as nuts and with beans, lentils, and tofu, actually. And then be physically active and try to limit our alcohol. Get outside and walk some. I mean, if we can get outside and go do something, if you go outside and walk for 10 minutes, that helps us physically and mentally to get outside and be as active as we can be. It promotes heart health. Activity just does so many things for us to do. I had some people say, well, I can't go outside and walk. I said, well, walk inside your house. You can walk around in one room or walk around in every room in your house, and that will help to increase, your activity. It also trying to do even some muscle strengthening exercises, because that actually helps to build our bones. So that goes into osteoporosis that I talked a little bit about last week. Also, it helps being physically active, helps to increase the good cholesterol called HDL. So we have super benefits with that. It says try to aim for about 150 to 300 minutes of moderate intensity physical activity each week if you possibly can be. And then be careful with the alcohol. Go easy on that. One alcoholic drink is considered to be around 12 ounces of beer or 5 ounces of wine or 1.5 ounces of a hard liquor. Men should try to limit their alcohol to around 2 drinks a day, and women should consume no more than 1 drink per day. But actually drinking red wine can actually help with heart disease. So have that 1 glass of red wine, not the whole bottle, just 1 glass, can actually be very heart healthy for us. So I hope that this gives you a little information today and gives you some thinking about prevention of what we can do with heart disease. Like I said, we'll attach the article to this talk, and if you have any questions on that or have any topics that you'd like for us to discuss in the future, just drop us a line on here. So thanks for listening and have a great day.